regarding management of hyperkalemia. Hyperkalemia is a medical emergency. First, confirm that it is true hyperkalemia by taking ECG. Sometimes ECG can be normal also. So whenever there is hyperkalemia, treat it as a medical emergency. First thing that has to be done is to protect the heart, because all types of arrhythmia can occur with hyperkalemia. The heart is protected by giving 10 ml of 10% calcium gluconate over 3 minutes. Remember 10 ml of calcium gluconate over 3 minutes. This hypercalcemia can precipitate digoxin toxicity. So if the patient is already receiving digoxin, you have to dilute it in 100 ml of 5% dextrose and give it over 30 minutes. Kindly note, the calcium gluconate does not protect or correct hyperkalemia, it just protects your heart. Insulin, it pushes potassium inside the cell. The dose is 10 units, again 10. Calcium is also 10 ml of 10% calcium gluconate, and insulin also 10 units. In 10 units of regular insulin followed by 50 ml of 50% dextrose over 20 minutes. If the random dextrose is more than 200 initially, you need not give dextrose, just give insulin with glucose monitoring. The effect starts in 10 to 20 minutes and lasts for 4 to 6 hours. And beta 2 agonist, albuterol, now known as salbutamol in our country, it causes hyperglycemia and tachycardia. But the problem is some 20% of patients will not respond to salbutamol nebulizer also. Hence, they have to be given along with insulin dextrose infusion. Bicarbonate, soda bicarbonate is rarely used because of the fear of hypernatremia. And removal of potassium from the intestine can be done by resins, diuretics and dialysis. Resins, the commonest one is sodium polystyrene sulfonate. Given a dose of 15 to 30 grams mixed with 33% sorbitol. The dangerous complication of giving this SPS, that is sodium polystyrene sulfonate, is intestinal necrosis of the ileum and colon. And there are other novel agents that are newly introduced. One such agent is the patiromer, which exchanges the calcium for potassium in the intestine. But the notable side effect of this drug is hypomagnesemia. And there is one more drug called ZS9, which exchanges sodium and hydrogen for potassium. Some cations are exchanged for potassium in the intestine. Calcium is exchanged by patiromer and sodium and hydrogen exchanged by ZS9. Diuretics, loop diuretics and thiazide diuretics can be tried in hypervolemic patients. And dialysis, it is the most effective method to correct hyperkalemia, of which hemodialysis is most effective and PD is less effective.